Have you ever felt an uncontrollable urge to move your legs, especially at night? Like there's something crawling under your skin, or a deep, uncomfortable tingling that just won't go away? If so, you might be dealing with Restless Legs Syndrome, or RLS, a condition that affects millions but often goes undiagnosed. Imagine settling into bed after a long day, but instead of drifting off to sleep, your legs start twitching, tingling, or aching. The only way to get relief? Move them. This is RLS, a neurological disorder that causes an irresistible urge to move the legs, especially at night or during rest. These sensations can feel like itching, burning, pulling, or even an electric shock deep inside your legs. It disrupts sleep, causes frustration, and can leave you exhausted the next day. Why does it happen? It's linked to several factors, including dopamine imbalance. This brain chemical controls movement, and if it's off, RLS can kick in. Iron deficiency. Your brain needs iron to function properly. Low levels, higher risk of RLS. Genetics. If your family has it, you might too, especially if symptoms started before age 40. Chronic conditions. Kidney disease, diabetes, and even peripheral neuropathy can contribute. Pregnancy. Many women experience RLS in the third trimester, but thankfully, it usually goes away after birth. Lifestyle triggers. Caffeine, alcohol, nicotine, and even lack of sleep can make symptoms worse. Some common medications can trigger or worsen RLS. Antidepressants, fluoxetine, Prozac, sertraline, Zoloft, venlafaxine, Effexor, amitriptyline. These affect serotonin, which can interfere with dopamine. Antipsychotics, risperidone, Risperdal, olanzapine, Zyprexa, haloperidol, Haldol. They block dopamine, making RLS worse. Sedating antihistamines, diphenhydramine, Benadryl, hydroxyzine, Vistaril, doxylamine, Unisom, often used in allergy meds and sleep aids. Anti-nausea drugs, metoclopramide, Reglan, prochlorperazine, Compazine. Calcium channel blockers, amlodipine, Norvasc, verapamil, commonly used for blood pressure, but they can also trigger RLS. Lithium, used for bipolar disorder, but a known culprit for worsening symptoms. Over-the-counter sleep aids. Many contain diphenhydramine, which can make things worse instead of better. There's no single test for RLS to be diagnosed, but doctors will. Look at your symptoms and medical history. Check iron levels. In severe cases, conduct a sleep study to observe leg movements. The good news? There are ways to manage RLS and take back control of your sleep. Lifestyle changes. Stick to a consistent sleep schedule. Cut back on caffeine, alcohol, and nicotine. Get moderate exercise, but don't overdo it. Try yoga, stretching, or massages before bed. Nutritional support. If iron levels are low, iron supplements may help. Magnesium and folate can also support nerve function. Medications for RLS, dopamine agonists, pramipexole, Mirapex, ropinirole, Requip, help regulate movement. Anti-seizure drugs, gabapentin, pregabalin, Lyrica, help calm nerve activity. Benzodiazepines, clonazepam, Klonopin, sometimes prescribed for sleep. Opioids, for severe cases. Tramadol, oxycodone, used rarely due to risk of dependence. If your RLS started or worsened after taking a certain medication, talk to your doctor about alternatives. Bupropion, Wellbutrin, is a dopamine-friendly antidepressant that may be a better option. Loratadine, Claritin, is a non-sedating antihistamine that may be safer for allergy sufferers. If left untreated, RLS can lead to chronic sleep deprivation, increased anxiety and depression, worsening symptoms over time, making it harder to function daily. If you suspect you have RLS, don't wait. Talk to your doctor and get the help you need. Stay informed. Stay healthy.